Hey guys, we're going to give you a quick overview of the structures of the respiratory system. To get oriented, let's review the cavities and the structures that make respiration possible. The openings of the body which air flows through are the nasal and oral cavities. From here, air travels through the pharynx, larynx, and into the trachea to end up at the lungs. The trachea bifurcates into left and right primary bronchi, which extend into each lung and split further into bronchial trees. Each branch terminates at the alveolar ducts and sacs, where the alveoli are. This is where gas exchange for life occurs. In the torso, the most superior cavity is made up of the rib cage and called the thoracic cavity. Inferiorly to this is the abdomen, which contains the organs of digestion. Between the thorax and the abdomen is the diaphragm, which separates these two cavities.
Supporting these structures posteriorly is the vertebral column. The vertebral column is an important structure in the body for support and movement and provides many surfaces for both muscle and bone attachment. This is made up of 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal vertebrae. The sacral vertebrae are fused, as well as the coccygeal vertebrae, and are also called the sacrum and coccyx, respectively. Overall, this is a total of 33 vertebrae. Anteriorly is the sternum, which is divided into 3 portions: the manubrium, the body, and the xiphoid process. These structures provide attachment for the clavicle as well as the ribs through the costal cartilages. Superiorly is the pectoral girdle, which includes the clavicle and the scapula. This provides shoulder muscle support and several attachment spots for muscles. Inferiorly is the pelvic girdle, made up of 3 bones that help support the organs. These bones are known as the ilium, the ischium, and the pubis.
Laterally is the ribs. The rib cage provides the basis for respiration, as well as most of the bony structure for the posterior, lateral, and interior aspects of the thorax. It is made up of 12 ribs, where they attach posteriorly to numerically corresponding thoracic vertebrae to form gliding joints. Regarding the anterior attachment, the ribs are divided into 3 kinds of articulation. Ribs 1 through 7 attach directly to the sternum with costal cartilages and are called the true ribs. Ribs 8 through 10 attach only to the cartilage of the 7th rib and are called the false ribs. Ribs 11 and 12 only attach to the vertebrae, which in turn are called the floating ribs. These attachments allow the rib cage to be relatively flexible during respiration due to the hyaline cartilage, providing the elasticity to expand, elevate, and depress while breathing. Regarding the muscles, here's a brief list of the accessory muscles of inspiration and expiration and their functions, as we will mostly be focusing on the primary muscles of passive respiration. However, these are important for helping to elevate and depress the ribs while breathing.
It's important to note that the interosseous portion of the internal intercostal muscles, as well as the abdominal muscles, are the primary depressors for forced exhalation, which is when more air needs to be pushed out of the lungs. The diaphragm is one of the primary muscles of respiration that plays a large part in quiet inspiration, which is the involuntary reflex we use for life. It is a thin, dome-like structure that helps to increase the vertical dimensions of the thorax when inspiration occurs. Innervated by the phrenic nerve and cervical spinal nerves C3 to C5, its job is to contract and pull the central tendon inferiorly, causing the lungs to follow due to intrapleural linkage and negative pressure created in the interpleural space.
The other primary muscles of respiration are the external and internal intercostal muscles, which connect each of the adjacent ribs for movement, stability, and anterolateral expansion of the thorax. The external intercostal muscles and the interchondral portion of the internal intercostal muscles are both innervated by intercostal nerves T1 through T11 and subcostal nerve T12, and both function to elevate, expand, and maintain rigidity in the thoracic wall. This following clip shows the movement of the ribs during inspiration with both the diaphragm and the intercostal muscles. In this animation, the elevation of the ribs during inspiration can be seen, as well as the relaxation of the diaphragm and intercostals that allow for expiration. It is important to note that passive expiration is not aided only by this relaxation, but also the elasticity of the ribs in the lungs, the torque of the cartilaginous portion of the ribs, and gravity pulling the ribs down. It is essentially a passive recoil after structures have been moved from rest.